How do you determine a practice's true cost of supplies? I get that question almost every day, and it's an interesting one. If you talk to dental practice management consultants, they'll agree that nationwide the average cost of dental supplies for a practice is roughly 7%. In other words, 7 cents of every dollar. But there's some hidden costs. To find the true cost for your practice, one question is, how much labor are you allocating? An interesting study where they actually were shadowing registered dental assistants throughout the state of California for an entire month, they determined that in the average practice, an assistant would spend on average 4 hours a week with the supply process. Some of those areas or activities in the supply process would include creating a list for the order, checking that list with catalogs to scribble down the right item numbers by that vendor. Another thing they would do is look through doors and cabinets to make sure that they have everything on the list. Then they spend time with the rep or a customer service rep on the phone or often online. In addition to the time of placing the order, then they're receiving boxes oftentimes from multiple companies throughout the week. If they're placing more than one order per week, if they're not organized, that takes additional time. If they have to return something for credit, they need to determine where they got it from. And then front labor costs would be cutting checks or credit card processing to pay the invoice. So on average, 4 hours per week. And conservatively, if a doctor is paying $20 to an assistant per hour, you're looking at $80 per week, which translates to $320 per month, or nearly $4,000 per year. And that's before you use your first cotton roll. So it's not just the 7%, it's also the true cost of labor.